this evening so that we can hear from everyone in the audience. If you're on the phone, you can vote by pressing the corresponding number on your keypad. If you are online, you can vote by selecting your response below the streaming player. If at any point in tonight's call you would like to ask Congresswoman DeLauro a question, simply press *3 on your telephone keypad. Again, that's *3. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. If you are streaming the event on your website, you can simply type your name and question below the streaming player. You can also get our e-newsletter by pressing *6. If you don't have a chance to ask your questions during the call, please note that you'll be able to leave a voicemail for the Congresswoman and her staff at the end of the call simply by remaining on the line. And with that, please welcome Congresswoman DeLauro.
Good evening, and thank you so much, Tom. And I want to say hello to everyone. Thanks for joining tonight's call. This is Rosa DeLauro, and I do represent Connecticut's 3rd Congressional District. I'm so looking forward to hearing from all of you about the issues that Connecticut veterans are facing. If you would like to ask a question tonight, please press *3 at any time. This will place you in the queue to speak to a member of my staff. Before we get started, let me say a few words and then introduce our guest speaker who will be helping to answer your questions tonight. As the daughter of a veteran, I have the deepest respect for the members of our armed services who have protected our country. I firmly believe that we have a moral responsibility to take care of those who have made great sacrifices to protect our nation, both in active service and in retirement. With over 30,000 veterans in the 3rd Congressional District, I am committed to ensuring those who have dedicated their time, their talents, their lives to protecting the United States of America at great personal cost to get the resources and the support they need and their families need to be able to thrive. Hopefully, most of you have heard about the recent expansion of eligibility for the PACT Act. This act was a major bipartisan success for our veterans, which I was so proud to support. More than 4.1 million veterans have already received free screenings for toxic exposures, a critical step to catch and to treat health conditions as early as possible. The expansion that was announced by the VA on March 5th means that all veterans who are exposed to toxins and other hazards while serving in the military, whether at home or abroad, are now eligible to enroll directly in VA health care. This includes veterans who never deployed, but who suffered exposure while training or on active duty on our home soil. This expansion will make millions of veterans eligible for care, up to 8 years earlier than originally written. That might include you. I want to make sure that our Connecticut veterans can take advantage of this opportunity. So if you have any questions about your eligibility, please follow up with the VA or a member of my staff tonight. I'm proud to support this expansion. I will continue to use my position as the leading Democrat on the Appropriations Committee to advocate for our veterans and for the resources they need to be able to live their lives. Congress just recently passed the Veterans Affairs Funding Bill for 2024, and it provides $3.9 billion for the Veterans Benefits Administration. This is a $36 million increase over last year. It is intended to enhance the VA's ability to process these new toxic exposure claims. More information on how to enroll in this coverage is available at va.gov/PACT, P-A-C-T, or on the phone at 1-800-MY-VA-411, The VA Connecticut is also hosting their own series of open houses on this topic, with the next one is tomorrow. It is Wednesday, March 20th, from 8:30 a.m. to 1 p.m. at the Aurora VA Clinic Annex. That's at 200 Edison Road in Orange, Connecticut. My staff will continue to share information about these events with you and veterans groups as we receive it. This expansion is great news. So much more to be done for our veterans. That's what tonight is all about, learning more about what you need and how I can help. And now let me introduce my guest for the evening, Dr. Becky Rhodes, the Executive Director of Veterans Affairs, Connecticut Healthcare, where she has served since October of 2023. Dr. Rhodes previously served as the Associate Director for the White River Junction VA Healthcare System in Vermont from 2018 to 2023. I'm so grateful that Dr. Rhodes is with us tonight. Together, I hope we can answer some of your questions about Veterans Affairs and hear more about your priorities for the future. Now, we want to hear from you. Press *3 to ask a question, and my team will connect you. And now, with that, let me introduce to you Dr. Rhodes. Take it from there.
Good evening, everyone, and thank you so much, Congresswoman, for both hosting this event and inviting VA Connecticut to be a part of it. We are thrilled both about the PACT Act and, of course, the Section 103 expansion from earlier this month, and we are here and ready to serve any and all veterans that are interested in coming to VA. The biggest change, which we'll talk more about tonight, is the eligibility to enroll directly for VA healthcare without first applying for VA benefits. That is the typical path that most veterans took previously, was to apply for benefits and then come to the VA. And this latest expansion under the direction of President Biden was that veterans are eligible to enroll directly for VA healthcare without that first step of going through the benefits process. So we are thrilled for that, and we are ready and eager to serve all of Connecticut's veterans that want to come see us.
We're going to hear from John. Would you like to take a question?
Thank you,
Go ahead,
Beth,
Congresswoman.
so much for your comments and for the some of this information, and we'll have more as the evening goes on. And so now let me open up the Town Hall to questions from our folks.
We have John on the line from Branford. John, you're on with the Congresswoman.
Hi, John.
Hello, Congressman Rosa. This is John Cushing calling, and I'm calling because I served for 6 years in the Army Reserve, and recently I inquired about whether or not I could be buried in a national cemetery, and I was told that the reserves are nothing more than a training unit and do not qualify, and I highly resent that, knowing that I served 6 years. And my unit, the 340th General Hospital, was ready for active duty at a moment's notice that we proved many years during summer camp and other times. I wish that you and the other congressmen would address this and get us at least some benefit for the 6 years that we gave to our country.
No, well, first of all, let me just say thank you for your service. And the first thing that I will say, what I understand, and I hear what you're saying, and I think there is maybe opportunity for us to try to do something, John. But you do have to be active duty in order for that to happen. And I know how much you resent that. Let me ask Dr. Rhodes if she has any comment on this, or if there might be a way for us to look into this on behalf of John and others who have served and who served their country.
Absolutely. Happy to look into that more. I will say, first to say, I don't know all the ins and outs of the National Cemetery Association benefits, but this is definitely something we can look into, John. So if you're able to leave your information with some folks, we could definitely look into this and get back out in touch with you.
John, why don't you do that? Again, understanding it has to be active duty training. Look, I believe we ought to honor all of those who serve in whatever capacity they do serve. And let's see what we can find out for you, my dear. If you then get to my staff your address and phone number, now we can reach you. We'll see if we can try to help you out. Thanks so much for calling.
Thank you.
We would like to take a moment to hear from everyone in the audience. We're going to ask a few quick poll questions. If you're on the phone, you can vote by pressing the corresponding number on your keypad. If you're online, you can vote by selecting your response below the streaming player. Here's tonight's first poll question. How would you describe your familiarity with the PACT Act, a law from 2022 that was enacted to improve health care and benefits for veterans? Press number 1 if you're not familiar. Number 2, somewhat familiar. Number 3, fairly familiar. Number 4, very familiar. So again, we're asking a law from 2022, the PACT Act, was enacted to improve health care and benefits for veterans. Let us know, number 1, if you're not familiar. Number 2, somewhat familiar. Number 3, fairly familiar. Number 4, very familiar. And let's hear from Barbara. Barbara's calling in, wants to talk to the Congresswoman from North Haven.
Yes.
Barbara, you're on with the Congresswoman.
Hello, Congresswoman.
Hi.
I have been fighting with the VA since July of 2022. Has really, I don't believe, has anything to do with the PACT Act. My dad was a World War II veteran, and I had filled out the paperwork for aids and attendance, and we were looking for support for home care for my dad, so it wouldn't have to come out of his pocket because he had never really utilized any of his VA benefits. And he, kept telling me, he was signing all the papers. I kept on this, and I believe I had called your office at one point, and I did speak with someone in your office, and then he had contacted me a couple of times, and then I didn't hear from him again. But I am working with somebody in Senator Blumenthal's office who's been very resourceful, but yet I'm still fighting with them. All they do is keep sending me, we need you to fill out this paperwork, and we need you to fill out this paperwork. And at one point, I even had a lovely woman from the VA call me and say, we need you to do exactly this, this, and this. So I wrote it down. I did exactly what she said. And a month later or 2 months later, I get more of the same. All I kept telling them is, are you waiting for this man to die? Well, that's exactly what happened. He died, and I no longer can get into his portal, and I call on the line, and you wait an hour and a half, and all I get is the people who I talk to have no idea what's going on because they're not the people who are making the decisions. So I'm still waiting, and it's going on almost 2 years, and now my dad passed away, so we're just trying to recoup what we spent.
Listen, let me first express my sympathy on the loss of your dad. It's very, very hard to lose a parent, and I know I lost my mom 6 years ago, and I think about her every single day.
My parents knew your parents because my mother grew up on Worcester Street.
Oh, God. Okay. Well, listen, this is what I'm going to ask you to do. I'm going to ask you to give us another try. I'm sorry whomever you spoke to did not get back. But my office number is 203-562-3718. And you need to call. And I have staff that's on the call tonight as well. And we need to get your name again and address, and let us try to see how we can help you out and how you can gain access to his portal and get the response, the positive response that you need to have. So, and again, I want to make sure we have your name and address and your phone number so that we can be in touch with you. And I promise you, again, as I said, because staff is listening, that we are going to get to you as soon as we can to get the information so we can be helpful. I'm asking you to take care of yourself, and again, I express my sympathy for your loss.
Well, thank you. You've been helpful. But now tonight you're getting beat up. You're getting overwhelmed. My name is Mark, M-A-R-K. My telephone number in Shelton, Connecticut is 20.
Mark, do you have a question for the Congresswoman?
What?
Mark, do you have a question for the Congresswoman, Mark?
Oh, yeah, but not tonight. I can call back. That's what I'm looking to do.
Okay,
Okay.
Mark, you wanted to leave us your number. What's your number?
203-92.
All right. Give us a call back, or we'll try to call you, okay?
Yes, thank you so much.
Thank you. Thanks for calling.
Congresswoman, we have a result from that poll question.
Yeah.
And we asked, how would you describe your familiarity with the PACT Act, a law from 2022 that was enacted to improve health care and benefits for veterans? And we had these results. 63% said not familiar, 19% somewhat familiar, 9% fairly familiar, and dead tie there, 9% very familiar.
God, excuse me, I have to comment on this. I think that's extraordinary. That's, and what I'd like to get to tonight, and I would ask Dr. Rhodes, please, let's explain the PACT Act so the folks who are on this call tonight have some idea of what's there. This is one of the most sweeping pieces of legislation to affect veterans. It's one of the largest expansions of veterans' benefits affecting veterans of all wars, whether they have served abroad or at home, and people who have been exposed to burn pits, to toxic chemicals, to nuclear material, X-rays, etc., who are eligible for health care benefits, and without a lot of paperwork that's involved, that's just happened in the past. The other piece I will let you know is, and the VA has been doing significant outreach, but it would appear that we need to do more, and I will give them this information from tonight's call, and we will push the VA to do more to get that word out. This is something that veterans need to know about. This is about your health. This is about what you can do, and this is about the services that the VA is offering. And Dr. Rhodes, if you would just briefly describe the PACT Act and how people might be able to access it.
Absolutely, and I hear the poll results and you loud and clear that we need to talk about it even more than we already do. So the PACT Act specifically is targeting veterans who were exposed to toxins and other hazards while serving our country. And that includes both at home and abroad. And those veterans are eligible to enroll directly in VA healthcare without applying for VA benefits first. This is all veterans who served in the Vietnam War, the Gulf War, Iraq, Afghanistan, and any combat zone after 9/11, and it includes all veterans who deployed in support of the global war on terror. It also includes all veterans who never deployed, but who were exposed to toxins or hazards while training or on active duty here at home. Examples: working with chemicals, pesticides, lead, asbestos, certain paints, nuclear weapons, X-rays, and more. So the PACT Act of 2022 expanded the health care and benefits for millions of veterans that were exposed to toxic hazards. And that was signed into law August 10th of 2022. This latest expansion is, you might hear it referred to as the 103 implementation, and this is began March 5th, so just earlier this month. Millions of more veterans are eligible. Rather than a phased-in approach, this is accelerating that access to VA care 8 years than was called for in the original legislation. And one thing that we hear a lot is veterans who have filed a claim with the Benefits Administration for a service-connected disability, but that were denied for conditions related to a toxic exposure, you should refile a claim. And we can give the number now or put it in the chat and make sure it's available. But through the Hartford Regional Office and our partners with the Veterans Benefits Administration, that phone number is 1-800-827-1000, and they can talk you through the options for filing that claim. Even if you were previously denied, we're encouraging everyone to reapply for those benefits. So the PACT Act is here to stay. The VA is here to take care of you for veterans and the survivors, and the sooner you file that claim, the sooner you can start getting your earned benefits.
Great. Thank you so much, Dr. Rhodes. I really appreciate that. And I hope, and we'll repeat that number again in a little bit so that people know where they can get the information.
Okay, Congresswoman, we have a question on the internet, and the question is, what can I do to get help if we have a friend who is a veteran struggling with mental health issues?
Well, you can first and foremost call the 988 hotline. If this is the veterans, it's just a crisis line, and if you are experiencing a difficulty, you can use VA services for mental health, even if you're not enrolled. And please reach out to see if you can do anything for someone. You also can call our office at 203-562-3718, and we can help to refer. But that 988 hotline number is very, very effective for helping to connect someone who is experiencing difficulty and mental health difficulty with the kind of support, medical support that they need. It has been very, very effective, and it was one of the things that prompted us to deal with the 988 line. Is so many folks who were challenged with mental health issues were being incarcerated or arrested for activities. And what we said is oftentimes this is not an infraction of the law, but rather it is a mental health issue, which is why the 988 number was established. Again, or you could call the VA for its services for mental health patients.
We're going to hear from Desiree in New Haven in just a second. And if you have a question for the Congresswoman, you can press *3 on your keypad at any time to get in the queue to ask a question. A member of our staff will collect your questions, and we will answer as many as we can during this live event. Again, you can press *3 on your keypad at any time to get in the queue to ask a question. And if you are participating online, you could submit your question below the streaming player. You can also get our news e-letter by pressing *6. Again, *6, and you'll get that e-newsletter. Now we're going to go to Desiree in New Haven. Desiree, you're on with the Congressman.
Thomas, can you hold for a second? Because with regard to the last caller, I want to make sure that last caller knows that even if you're not enrolled at the VA, you can use their services for mental health. So they get some services through that vehicle. Is that right, Becky?
Yes, it is, ma'am. That is we have the option for emergent care under our humanitarian guidelines to serve veterans, even if they are not enrolled for health care. Also on the 988 number, if someone doesn't want to call, there's ability to chat online. There's a text message, that number that they can use. They can text 838-255 if that's a more comfortable way for someone to interface with, and that's a 24/7, 365 service that's available.
That's great. I hope the individual, well, we have a name. I hope that individual was still listening, because I think you've hit the nail on the head with very good information for someone. Thank you very much, Dr. Rhodes. Okay, Thomas.
We have Desiree from New Haven. Desiree, you're on with the Congresswoman.
Hi, Congresswoman DeLauro.
Hi, how are you?
I'm good. Thank you for doing this. I have many questions, and I will call your office to ask those many questions. But my main question is, I'm familiar with like the Camp Lejeune and the drinking water a little bit, and know my father, who is a veteran, is not impacted by that. However, I am not really, could you elaborate, or have someone on your team elaborate maybe a little bit more about when you say improve healthcare services for veterans? What does that mean?
Let me ask Dr. Rhodes, you want to take that, and I'll add something to it, but you go ahead.
Sure. What we're talking about here is applying for benefits under the PACT Act for exactly your situation. I think what you're referring to is that we have some screening tools that have been used to help identify people that were at, say, Camp Lejeune in the time frame specified, and then as a follow-on to that, this is where the PACT Act really expands the benefits associated with veterans who were exposed to toxins, which sounds like in your case, that's at home or abroad. Does that answer your question?
That helped answer your question. I hope so. Improved benefits equal expanded benefits, so that millions more veterans are eligible for health care and financial benefits, and many more from more presumptive conditions. And why don't you, Dr. Rhodes, define presumptive conditions?
Perfect segue. So presumptive conditions are where there is established linkage between an environmental exposure and a condition. And there's a presumption that if you were exposed to one thing and subsequently have a condition, that those two things are linked. And so when we talk about the expansion, and I referenced it a little bit earlier, where people had previously applied for benefits and being related to a toxic exposure that they had while they were in the service, and those service-connected disability claims were denied. And so under the PACT Act, that's why we're encouraging people to reapply for those benefits, because there are many presumptive conditions under the PACT Act where there is an established linkage between there, and we're able to both grant benefits for that and also provide health care. If the benefits route is not the way that you want to go, you would be eligible for VA care even without the benefits side of things, where we could treat the condition that you have as a result of those toxic exposures.
Thank you, and thanks for the question.
We have a second poll question tonight, Congresswoman, and we'd like to take a moment to hear from everyone in the audience. I'm going to ask this poll question in a second. If you're on the phone, you can vote by pressing the corresponding number on your keypad. If you're online, you can vote by selecting your response below the streaming player. If you have a question for the Congresswoman, you can get in the queue by hitting *3. Here's a second poll question. Which category best describes you? Number 1, I have an immediate family member who is a veteran. Number 2, I have a close friend who is a veteran. Number 3, I myself am a veteran. Number 4, I am an active duty member of the military. Number 5, none of the above. Again, poll question number 2, which category best describes you? Number 1, I have an immediate family member who is a veteran. Number 2, I have a close friend who is a veteran. Number 3, I myself am a veteran. Number 4, I am an active duty member of the military. Number 5, none of the above. And we're going to go to Harvey from Brantford. And Harvey, you're on with the Congresswoman. We're going to go to Harvey from Brantford.
My question is, I'm a Vietnam vet, and I have type 2 diabetes, presumptive for exposure to Agent Orange. I had also had kidney cancer a few years ago. I did apply last year under the PACT Act, but I was basically, and it went through the whole process, but I was told that that's not covered under the PACT Act, even though possible exposure to Agent Orange. Can you help?
Dr. Rhodes, help.
Thank you for your service and for your question. The specifics of which is definitely something we would need to dive into. So I'll again ask the Congresswoman's wonderful staff who are on the line to get your information so that we don't do that in this public setting, but definitely something we want to talk more about and get some more details about.
Let me just add this to it, and please do let us have your information, Harvey. But it is my understanding now that kidney cancer is a new presumptive condition. So let's look into this for you, and let's just see what we can do. It's just very clear in the information that I'm looking at that this is kidney cancer is listed as one of the presumptive conditions. And again, depending on the service, et cetera. So that's why we need to have the information from you as to the particulars of your of your case and your circumstances. Thanks so much for calling, Harvey.
We have poll results from that question number 2. The question was, which category best describes you? I have an immediate family member who is a veteran. I have a close friend who is a veteran. I myself am a veteran. I am an active duty member of the military, none of the above. 29% have an immediate family member who's a veteran. 21% have a close friend. 32%. I myself am a veteran. 0%. I am an active duty member of the military. 19%, none of the above. Was poll question number 2. If you want to get in the queue tonight, the Congresswoman, *3 on your phone to get our e-newsletter, *6. And we'd love to hear from you. And we're going to go to Robert. And Robert, you're on with the Congresswoman. Robert, you there? Hello, Robert, are you around? Okay, let's go to Larry. Larry in Woodridge. Hello, Larry.
I'm here.
Hi, Larry.
Larry, you're on with the Congresswoman. Go ahead.
Hi, Congressman. Thank you, first of all, for you've been backing the veterans for so many years, and you've served as much as I have. But I have a simple question.
Sure.
Is there any consideration to providing free health care to the veterans, so especially seniors, where they don't have to take out money from their Social Security?
Dr. Rhodes?
Yes, ma'am. We do. I mean, again, I hate to say that it depends on the specifics. If this is where we want people to come to us and bring your DD-214 and come talk with our eligibility staff about eligibility for VA care. We have small copays for some things, but the vast majority of the care that is provided through the VA is at no cost to the user. And so small copays for sometimes medications, $1, $2, $20, sometimes for various appointments. But like I said, the vast majority of the care that we provide, certainly the medical care, and one thing that VA really prides itself on is taking care of the whole person and the whole veteran and asking questions about living situations and food insecurity and things outside of specifically the healthcare delivery part, but certainly things that make up whether someone is a healthy individual or not. And that's one thing that we have wraparound services at VA. So if that's a question for you or anyone in your life or anyone on this call, really encourage you to call the VA and talk with our eligibility staff about your eligibility for or a family member for getting care through the VA. The phone number for our West Haven campus is 203-932-5711, and we would love to hear from more veterans who are interested in finding out if they're eligible and then coming to see us for their health care and, again, all those wraparound services.
We have an online question. We'll go to that online question. And the online question for the Congresswoman,
Thomas,
what are you
just hold
doing
for a
to
second. I want to mention this to Dr. Rhodes in view of the last question. This depends on what priority group you are in and how you move through those priority groups, if you will, to get access to care and more free care. I don't know. Removes co-payments, etc. What's that about?
At least she's honest. She doesn't know.
Dr. Rhodes?
Yes, I'm here. Maybe I didn't hear your question.
I asked you about priority group. This was with regard to the last call. And, if you move through this priority group, as you said, somebody should be in touch with you because then there's potentially less co-payments depending on the disability or, et cetera. Is that accurate?
Absolutely. Absolutely, yes. The priority groups are the thing that determine where those copays come from, if you have them in the first place. And certainly any time there is a change in your financial situation, you should update us because that can impact and change copays and benefits through VA.
Okay, thank you. I'm sorry, Thomas. You've got an online question?
We have an online question, Congresswoman, and the question is, what are you doing to protect funding for existing veterans' services?
Well, let me just tell you, that's what we're trying to deal with, on a regular basis. It's not only are we trying to protect existing services, but we are trying to add on to services that we provide to veterans, understanding the role that veterans have played and the sacrifices that veterans, have made. No one is talking about removing existing benefits, but only trying to add on. In the Toxic Exposure Fund in the PACT Act is always we're always fighting for that, and we're fighting to get it fully funded for the VA every single year, so that the Toxic Exposure Fund would be there. What we want to do is the funding provided in last year's act. The bill provides a total of $134.8 billion in appropriations for fiscal year 2024, and that's an increase of $48 million from the 2023 level. So we're trying to increase continue to increase the level, and the resources help to expand access to services for veterans. This is money for veterans' medical care. It's money for mental health care, for homeless assistance programs, for substance use disorder programs, and for whole health initiatives. So we are trying to preserve existing benefits, but as I said, to add on to benefits, understanding the new circumstances that have arisen, and that's why we did what we did in the PACT Act to be able to do this. We are trying to fully fund the Toxic Exposures Fund, that we want to ensure that dedicated funding for the PACT Act is there, that is, dedicated funding is there for the PACT Act, and we made a promise to the veterans in the PACT Act, and we will keep that promise.
Quick reminder for anyone still joining the call, if you would like to ask Congresswoman DeLauro a question, please press *3 on your telephone keypad now. If you are streaming the event on our website, you can simply type your name and question below the streaming player. Again, to get in the queue with the Congresswoman, just press *3. We have a poll question number 3, and this one is, thinking about what you heard from the Congresswoman and our guest, did you find tonight's town hall helpful to you and your family? Number 1, not helpful. Number 2, somewhat helpful. Number 3, fairly helpful. Number 4, very helpful. Again, poll question number 3, thinking about what you heard from the Congresswoman and her guest. Did you find tonight's town hall helpful to you and your family? Number 1, not helpful. Number 2, somewhat helpful. Number 3, fairly helpful. Number 4, very helpful. Let's go to Robert. And Robert is on with the Congressman.
Hello?
Robert, now
Hi, Robert.
turn your volume down. You're on with the Congressman.
Hello?
Hi, how are you tonight?
Good. Could you hear me, Congressman?
Yes, I can, my dear.
In 2018, I received a 10% disability for tinnitus. In 2023, outside of the VA system, it was discovered that my body is filled with heavy metals. I have not been able to get anybody to agree at the VA to look into this any further. It's now leading to some heart issues, and I'm a little concerned that they want to go a route that's mechanical and not looking at the causes. So I've been getting treatment outside the VA system, and it's costing me thousands of dollars. So I don't know what to do. I don't know if the VA recoups or will reimburse me for those services that I'm getting outside the VA. I just feel like I needed another choice than going through surgeries and open heart surgery and cardiac stents and all this stuff that they proposed for me. So I'm just a little concerned, and I don't know really what to do.
Well, thank you for calling, and I don't know where you served, but I thank you for your service, and I'm really struck by your body being filled with heavy metals. Now, what I need you to do, though, is what we need to do is to go to the VA. We've got to do that, and let's try to help you to do that. And again, I would want your name and address and your phone number because you need to get to the VA. We need to get them to look at your circumstances, and if eligible, you can get they can cover care in the community. And we want to have the VA be able to help you, and hope they can. But let me get Dr. Rhodes on the phone here to address this, to see if we can provide some help to Robert in this effort. both, I mean, with his treatment and what is happening with the expense of this treatment and how he can be helped, Dr. Rhodes.
Congresswoman, if you're looking for another job, I'm going to pull you over to the VA because you exactly advised Robert as I would advise him, which is to come see us so we can talk more about your situation and how we can help, because we want to help. We want to be there to help. Whether you get care through us or in the community, we are there and we want to help. And so we want your information so that we can reach out and follow up and see what we can do for you.
Thomas, I'm going to ask you a question. Robert, stay on the line. Is there a way for us, are able to get the addresses and phone numbers of these people, of the folks who have called, and that we've recommended that they get us this information so that we can follow up with them? I get concerned that we tell someone something tonight and that there's no way for us to really follow up. Clearly, my office number is 203-562-3718, and to folks who we've told to call, you can call that number, tell whomever was our person answering that you were on the Townhall, and I told you to leave us your name, address, and phone number so we can be of help.
Yes, Congresswoman, we'll gather that info for sure and be able to make that connection. And let's go to Maureen. Maureen is in Shelton. You're on with the Congresswoman, Maureen.
Okay. Hi, Congresswoman. I just wondered, they're going to build a VA facility in Trumbull, Connecticut, and some of the veterans were asking me, are they going to provide primary care services at that facility?
Dr. Rhodes, what do you know about this?
Hi there. Thanks for the question, Maureen. One thing I'll say about primary care is that it is our gateway to all other services, and we love for all veterans that see us to have a primary care physician or provider, NP, PA, et cetera, through the VA, so that person can be the gateway to all other services. All of the community-based clinics that we have offer primary care. We put that everywhere, and then the other services that we add into any of those community-based options are in addition to primary care and mental health as two of our foundational services that we offer at all of our community-based locations.
Now, what do you know? To be very honest,
what's this
I don't know.
New facility is going to involve?
I don't know anything about a facility in Trumbull. Dr. Rhodes, do you know anything about a VA facility in Trumbull?
I do not.
It was in the newspaper that they were going to build this facility for veterans in Trumbull.
Okay. Was it in? Do you know if it was? Maybe it's in the Trumbull Times. I see it says the town council approves a new home for Trumbull veterans groups. So this must be a group home, not actually a VA facility. Let me just see. I'm trying to actually looking this up. A new home for Trumbull veterans and first responders took another step closer to reality this week when the town council unanimously approved the design of a new 5,000 square foot building on the site of the Veterans Organization building. It's about a $3 million project. They're going to look to state and federal grants. And they also say that Trumbull taxpayers may have to kick in some money. But that is what this is about. So it's at the very earliest stages of looking at a facility or a group home type place, not other VA facility here. So anyway, so that's what was in the newspaper, but and we just tried to look that up. So anyway, I think that's all that it tells me about this. They're going to ask.
Well, thanks.
Anyway, so There we go. That's the information, okay?
Congresswoman, we have Deb from Milford. Deb, you're on with the Congresswoman.
Hey, Deb.
Hi, how are you?
Well, thank you.
Oh, don't mind me, I'm getting choked up. I was calling because I was wondering, is COPD a part of the PACT Act if you were in Vietnam?
Dr. Rhodes, let me just, what do you say? I have here, chronic obstructive pulmonary disease, COPD, is presumed to be a service-connected, and that should be. Look, now, obviously, you got to talk about the situation, et cetera, and you talked about your service in Vietnam. So this is the kind of thing you need to find out about it. You need to get to the VA, call them, and find out. So what is startling to me tonight is that 63% of the folks in our community do not know what's in the PACT Act. And it says that COPD is a presumptive illness. It's to be service-connected, but you need to find out whether or not you are eligible.
Okay. All right. Well, thank you so much. I appreciate you.
Listen, thank you so much for the call. I appreciate it.
And I also wanted to tell you, Congressman, that my husband has been going to the VA, and they are absolutely wonderful once you get hooked up with them.
Great.
They really, really have been wonderful with him. So, thank you so much.
You're very, very welcome, and I endorse. I mean, you get great health care at the VA. So I want you to now. Your husband is being taken care of. You need now to see about yourself. Okay.
All right. Thank you, hon.
You take care. Okay. Bye.
You too. Bye-bye.
Unfortunately, that's all the time we have for questions. We appreciate the opportunity to speak directly with you and answer your questions. If we were not able to get to your question this evening, you can contact us through our website, DeLauro.house.gov. That's DELAURO.house.gov, or leave a voicemail after the event, and we will host more of these events in the future to keep you informed.